Children's Hospital today, and it's a special privilege to welcome Governor Healey and First Lady Lidgate. Thank you both for being here today. Thank you. Thank you. At Boston Children's, our mission is clear: to improve and transform the lives of children through groundbreaking compassionate care, research, and unwavering commitment to every child and their family, no matter the circumstances. That conviction drives our work every day, and we are honored to stand with leaders like you, Governor, who are committed to building a healthier and more just future for all of our children. So please join me in welcoming Governor Healey.
Thank you. Thank you. Well, good afternoon, and thank you so much, Dr. Churchwell. Joanna and I just had an incredible tour, visiting with staff and some of the young patients and the families here at Boston Children's. And we are delighted to be here today, joined by our Secretary of Health and Human Services, Kate Walsh, our Commissioner for the Department of Public Health, Dr. Robbie Goldstein, our Undersecretary of Economic Strategy, Sarah Stanton, as well. So, look, with everything that's going on, we wanted to connect with doctors, nurses, medical staff, hear how they're doing, share our support, and we want to make absolutely clear about what is at stake and who is being harmed. Who is being harmed by federal cuts to medical research and cuts to healthcare coverage. We're so proud of and grateful to the incredible medical community and research community that we have here in Massachusetts. They deliver the very best healthcare in the world. Boston Children's is a shining example. Children's is ranked #1 in the world as a pediatric hospital, #1 in the world, right here in Boston, in Massachusetts. It's home to the world's largest pediatric research enterprise. It's one of the top teaching hospitals in the world. It treats more children with rare diseases and complex conditions than any other hospital. Children's is also the leading recipient of pediatric research funding from the National Institutes of Health, NIH. That means it is not only healing sick children and very sick children, it is also producing the cures, the therapies that will save children's lives for generations to come. The attacks that we're seeing from Washington, from Donald Trump and his administration, from Elon Musk, are directly aimed at these children, directly aimed at these kids. That's what's on the line. The NIH cuts are already disrupting medical research and clinical trials. Children's receives, for example, $230 million from NIH funding every year, and they could lose more than half of that funding because of these cuts. That means halting research into diseases that harm children, ripping away hope from families like the families Joanna and I just met upstairs who are facing devastating diagnoses. These cuts are going to cost jobs. They're going to cost lives, young, vulnerable lives. It's not rhetoric. It's not hyperbole. It's a fact. And it's not just here at Children's. It's undermining our entire ecosystem of medical research and care here in Massachusetts and around the country, frankly. These NIH funds go to institutions in every state across this country. We're also seeing at the same time a GOP budget plan that would cut deep into Medicaid. You've seen this. They want $4.5 trillion in tax cuts. And how do the Republicans propose to pay for it? By cutting into Medicaid, among other programs. To put that in perspective, right here at Children's, 46% of patients are enrolled in Medicaid, are enrolled in Mass Health. These are the youngest and most vulnerable members of our community, and they're being targeted not only here, but across our state and country. Everyone needs to understand how very serious this threat is, and everyone needs to understand the cuts that are being proposed in order to fund huge tax breaks for some of the richest people in the world are going to come on the backs of these patients and their families. I don't know what kind of value system would lead one to propose such a thing, but I know the people here at Children's have different priorities. They give everything they have to the children who need help, who are in their care. They give their time, their talent, their heart, and their soul, and they bring hope and healing to families, not just around Massachusetts, but around the world. And the kids here fight with everything in their might. We just were with these little babies and these little children, and you can just see how hard they are trying. And that's why I will do everything that I can to fight for them. This is about care, and this is about children. I want to thank everybody here at Children's for the work that's done day in and day out. Children's is an institution that makes us proud to be from Massachusetts, makes us fortunate to live in Massachusetts, and they inspire us to keep speaking up, to keep bringing the pressure so that we can do all we can to stop these terrible cuts from continuing and going forward. And with that, I thank you, and I believe we're going to open up for some questions on topic.
Can you talk a little bit about how Children's is obviously poised to lose more than $100 million. And I know the Trump administration, has been sued over this, and there's been some temporarily blocking. Can you talk about how, whether or not this will have an impact now, whether or not these cuts are going, has Children's felt the impact of these cuts?
Well,
Where will it?
let me just offer some general thoughts, okay, to that, and obviously invite Dr. Churchwell to speak with respect to Children's. But I can tell you, as I speak, these cuts have already had an effect. They've already had an effect in Massachusetts. As some know, the attorneys general took the Trump administration to court to fight them on this NIH cut. The court ordered that that cut not go forward and that the NIH funding continue to flow to Massachusetts, to states around the country. What we have heard is that that funding isn't coming through in all instances. So already we have seen an effect. We've already seen institutions, colleges, and universities here in our state and research programs cut back because of these cuts to NIH funding. This is a really, really big deal. And, right now we have programs making decisions not to continue with postdoc programs, not to fund research programs because they're not going to have the money because of the NIH cuts. That's a really, really bad thing. First and foremost, it's a bad thing because it means the people who are doing the research that is going to find the cure to cancer, to Alzheimer's, to Parkinson's, to ALS, to diabetes, heart disease, that's not happening. We have clinical trials here in Massachusetts and patients in trials who've actually had their treatments stop because of this. Can you imagine the cruelty of that right now and what families are dealing with? We also see the presence of others looking to compete for our talent. There's a reason Massachusetts is #1 in the country: education, innovation, and healthcare. We've got this incredible ecosystem, of research institutes, of teaching hospitals, of universities. And what President Trump is doing through this is basically saying to other countries, come here for business and take our people, take our intellectual property and assets. And so we have other countries right now on the ground here in states around this country, from China, from Europe, from the Middle East, offering to our postdocs and others and researchers and scientists, move overseas, come to us. We'll give you a lab, we'll give you staff. That just doesn't make sense for an agenda that's supposed to be about America first. We're giving away assets to other countries instead of retaining them, growing them, supporting them here. That's some of what I've seen and heard. Dr. Churchwell, I invite you, and certainly Secretary Walsh, Commissioner Goldstein.
Governor, I think you said it extremely well. The answer is yes, we've seen cuts. What time is it? It's not Friday, is it? But every Friday we hear something. And it's causing not just the cut that happens, but also the anxiety that the governor talked about of our research staff, our research enterprise. As she mentioned, we're the leading recipient of NIH funding for pediatrics in this country. How that translates, it translates to discovery, that translates to new drugs, to new therapies. This is where sickle cell is being solved. This is where cystic fibrosis was solved. This is where polio was solved. And the issues that we're confronting are issues we're very much concerned about. We are, actually, it's really around vaccine work that we're seeing the most engagement or stoppage around. We have worked with the CDC and the FDA regarding that. And we've seen just a stoppage of that that's been significant.
Can you elaborate on that? What type of stoppage? What we're
We have contracts with the CDC and the FDA in terms of monitoring flu, as an example. We have been one of the leaders in that regard, and those contracts have been stopped.
You got to lay anybody off? Is there staff reductions?
No, we're working pretty hard to really identify where we can support our staff. It's a lot of stress on the system, but we believe that the people that we have here are incredibly important, and we're working to support them.
The White House repeatedly says that it is not cutting Medicaid. They put out a press release just a few days ago that says the Trump administration will not cut the Social Security, Medicare, or Medicaid benefits. What's your response to what you're seeing on the ground versus this messaging that they keep saying they're not looking to cut?
Speak on the ground.
I can take a crack at that. I think that we have not seen Medicaid cuts yet, but they need to get $880 million out of one committee in Congress. We just don't know how they would do it without touching Medicaid. And we think the cut for our state is very, very sizable in the billions.
Governor, obviously we've seen multiple court challenges come forward, but in many cases the Trump administration has just steamrolled forward with what they wanted to do. So, I mean, do you have concerns that these safety rails just aren't holding at this point?
I think the vast majority of Americans, doesn't matter what party you're in, want the president and the administration to follow the law. I mean, we are a nation of laws. Congress, makes policy, makes laws. Sometimes I agree with them, sometimes I don't. But what is bedrock in terms of the way our government is constituted and our democracy is that you have the courts, they have a role, and presidents, administrations have followed federal court orders always. So it's very concerning. Yes, I am very concerned about that. I'm concerned about what I have heard about the administration's failure to release funds, whether it's for NIH or for any number of the other federal programs that they've tried to stop funding on and have been taken to court on. Recently, I think earlier today, there was a hearing in federal district court with regard to a resident, actually, a medical resident from Brown University who was deported, even though she had a visa and has been a professor teaching here, and that was over the order of a court not to deport her. So it is very concerning, and it's why people need to, one, understand what's going on out there, and really make sure they're talking to members of Congress to say this can't hold, and certainly the members of the administration. Sometimes I wonder if the Trump administration really understands what they're doing, and it is important that we educate members of the Trump administration and President Trump about the impact of things like cuts to medical research. I don't know anybody who doesn't want America doing all we can to power the research for cures and treatments for diseases that touch all of our lives. Every family in every state, doesn't matter what party you're in, is at some point afflicted with one of these diseases and challenges. And we have this strong interest in making sure that that's not interfered with, and that the work of the CDC continue and the FDA continue. You know what building you're in right now? You're in a building that was named after a guy, John Ender, who helped discover the polio vaccine, right? Right out of here. I got that right? Okay. So just like to situate yourselves, Massachusetts is, I'd say, a very special place in terms of what we contribute to medical research and discovery and innovation. But there are a lot of states that do and a lot of institutions that do. And we've got to make sure that they understand just how serious these cuts are. Again, I'm at a loss for some of this. The other day it was healthy food in schools. What's wrong with that? We don't know what it will be tomorrow, but this is a really, really important one. And I don't know anyone who could go up and have the experience that I just had visiting with families and seeing these seen these little kids and, want to take that away, want to take that hope away from any family. We're better than that.
Governor, you've used the line a couple of times over the past couple of weeks that foreign countries are here recruiting our postdocs. Do you have specific examples of that, and how is that any different from a company from overseas just recruiting in general?
Well, I'm all for healthy competition, and we're everywhere recruiting, including recruiting in other states. I was just meeting with the Minister of Enterprise and Trade for Ireland this morning, talking about the important relationships that we have and that we want to do and the companies that we want to bring here. I did that with the Canadians last week. That's normal. What's not normal, though, Chris, is when you simply give the keys and turn everything over to another country, which is effectively what's happening, because you shut down when you literally turn off the lights. Indirect, this stuff around what's indirect, direct grants. Look, at the end of the day, to do research, and I'm not a researcher or scientist, but from what I know about it, like, those guys need to have buildings to operate in. They need to have power. They need to have cooling. They need to have a sterile environment, right? There's like stuff that they need to be able to do this research. All that's been shut down with these NIH cuts. It goes away. So you shut down the research. That's something different from just competition. And that's why it's, people are just rushing here to say, hey, come to our country and we'll set you up. We'll give you that lab. We'll provide that energy. We'll provide the supplies. And by the way, we'll supply personnel to staff your lab. We do. Yeah. Yep, the University of Massachusetts.
In what instance? Who came and
Why don't you get more information directly from them? But it's been reported to me that in that instance, China was on the campus recruiting. I've also spoken with other entities who've reported that it's not limited to China. We have folks coming from the Middle East and from Europe, and that's their prerogative to come. They want talent, so they're coming to Massachusetts. They're coming to America, and they're looking to take our talent, because effectively, the Trump administration is doing things that gives it away. And as somebody who is really competitive and really protective of Massachusetts and the resources we have here, that's not a good thing. Okay, great. Thank you. Thanks again to the wonderful team at Children's.